Thanks for being here. The launch of the Contraceptive Acceptability Research case study in Zimbabwe is being described as a significant milestone in expanding access to innovative, user-controlled family planning methods. According to the creators, the Annovera contraceptive ring, designed for discreet at-home use, requires minimal clinical intervention, making it an attractive option for women and adolescent girls who face socio-cultural and logistical hurdles in accessing traditional contraceptive services. But there are concerns about exploitative elements as Zimbabwe becomes one of the first countries in Africa to conduct a pioneering trial of this nature. Several other key issues for consideration, such as acceptability and uptake, cultural and social implications, healthcare provider training, accessibility, and affordability also come up. For some informed perspective, I'm joined now by health professional Sibanda James. He is a specialist sonographer at Zimbabwe Health Apex team. Thank you very much for being here with us. Hopefully we'll get a second guest on. We don't have her now, so I have not introduced. Now, the caption of one report is Zimbabwean women used as guinea pigs. Let's start there. What is known about this Annovera ring and its potential prior to this human study? Sibanda.
Yes, my sister. I can hear you.
Yes.
Thank you very much for... Okay, can you come again?
Yeah. Did you get my question? Just go ahead and respond, sir.
So it's fine. We as Zimbabwean people, in particular, as you have highlighted, that there is controversy in the use of the Annovera ring amongst our people, to be specific, our women. For a very good example, this is a contraceptive accessibility research. We can't be found celebrating a research because a research can come out with negative results. So for the meantime, we cannot ululate and say we are far much ahead because our people are being used as a sample to test the accessibility of it. In that manner, that's when the controversy comes in to say, yes, you are conducting a research amongst our people. What if there are negative effects to come? Who is going to compensate on that? What is going to happen? So actually, it's an issue of bone contention to say we would want to use Annovera ring amongst our people, and we're happy about that. In the scientific research, you don't celebrate the conduct of a research, you celebrate the results of a research. So for now, as a nation, it's too early for us to clap hands for ourselves to say we have done a milestone because our people are being used as a sample in a research. That's not proper.
Okay, Sibanda.
Wait.
Sibanda, there's a reason I asked. I asked what is known about the Annovera ring prior to this human study, because I know that before your country will even accept that such a research data collection process is allowed, they would have, perhaps done some vetting of the Annovera ring. So I'm trying to understand from you, being on the ground, was Annovera ring known prior to this data collection exercise?
No, there was no much knowledge to it. As a contraception, most of the people in Zimbabwe were not privy to it. And it is the first time it being tested to our people.
Okay, so what do we know about the safety of this ring, and what is your government saying? Because the reports that I saw is from the creators who are looking at it as an innovation in an effort to improve on contraceptive methods that are available. What is your government saying about this exercise?
Yeah, from the look of things, the government has given a note for the go-ahead for people to go through the contraceptive to go through the testing phase. They have allowed it. That's why it's being done. Unfortunately, there is not much of knowledge to the after effects of this contraception. We wait for the result of the study, though literature is stating that there are a number of negative effects when somebody takes the Annovera ring, or uses the Annovera ring, sorry.
Okay, I'm trying to establish the safety here for the women who are going to be part of this data collection or process, and it's been touted as an innovation. But I'd like you to speak on one of the other things that was talked about was how it is going to inform the country's family planning policies and programs in Zimbabwe. From your position, how do you see this happening? What are some of the potential benefits that they talk about this ring that you think may inform further decisions with family planning?
Yeah, if we are to allow it to be used in terms of our health system set up, since we are saying it's going to be used, you use it for a year, and then you have to come back. In terms of our rural population, it's a good thing, because if there are no negative effects, we would say it reduces the worker, the health worker, and patient interaction. Somebody comes in, takes the ring, it goes out maybe for a year, and then has to come back. And it's easily distributable to remote areas. It's okay. That is if there are no gonna be serious side effects.
Okay, before we continue this conversation, I'd like to hear what you think about this talk about efforts that contraceptive innovations like this in family planning is a way of indirectly controlling a population. Is that, first off, do you give credence to such conversation? And if that is actually what is happening, is it such a bad thing considering our population in the continent?
Yeah, in terms of social implications, I would say personally, as Zimbabwe, we are still a very small country. It will be to our advantage if we are to multiply in our numbers as quickly as possible. And for us as a nation to advocate for controlled population growth, yet we have got a very big nation with very few people. It's unfortunate. It deter our growth in terms of numbers. There is power in numbers. So I would say putting too much effort on avoiding death is not good. I would rather put too much effort on promoting population growth as a nation. It's to our advantage as a nation because there is power in numbers.
Okay, let's go back to the core of our conversation, and I'd like you to speak to some of the potential challenges you foresee with this exercise about getting further data as to accessibility of contraceptive for local women.
Come again, I didn't get you.
I'm asking you some of the challenges you foresee with this whole process of trying to collect data as to how women will accept this contraceptive method.
It's unfortunate if you are to realize that the Frontiers team concentrated on the age 18 to 25 in Zimbabwe. That is a young or a tender age in terms of reproductive women in Zimbabwe. I would want to ask them, why are they targeting 18 to 25? In Kenya, I think they went as far as 45. In terms of Zimbabwean way of doing things and acceptance, we are much concerned with the reproduction than controlling it. So for our women to easily accept that and use it, it might be a challenge. Another thing is this is a removable. It's susceptible to falling. It's not permanent. It's not. I cannot say it's user friendly, because if you are to realize that there is too much insertion of the contraception, which is not a good thing for the health of a woman.
How aware are women in Zimbabwe about contraception, and how available is contraception for family planning?
I would say the oral contraception availability in Zimbabwe is very good. We are not short of that contraception availability. We have got vast of it, and there are no challenges. And they would wonder why there's still more effort being put into a number of varieties of contraceptives, yet we've got a number of them that are user-friendly, that are working well for us. Though we are saying as a nation, the use of contraception as a way of controlling our population is not good for us. We need to grow as a nation and multiply.
Okay, so the sense I'm getting from you is further research is required before human testing in order for you to know the efficacy of what they're going to do. But on the other side of that, first off, am I correct with that assumption? That's your position. But on the flip side of that submission is, if they don't carry out this study, how will they have the data to know how effective it would be for women, not just in Zimbabwe, but in other African countries?
There is no other option to say. Every medicine that is manufactured has to be tested on human beings, but consent is required. Sexual data needs to be there. We need to be very realistic when it comes to the consequences of the outcome for the population. It's good in terms of this research. They are being open and not forcing people to go through it. They've come open and they are asking for consent. It's okay. We have no option. But the question is still stands. Why are we concentrating much on reproduction? Don't we have other burdens in Zimbabwe? Zimbabwe is burdened by cancer cases, non-communicable diseases, which needs aid. Why are we not going through that route? Why controlling the population instead of promoting the living of the already existing population?
All right, I guess that's a good place for us to leave it, with more questions as to what it will be like for the women who will be using it in person. Thank you so much for sharing some understanding on the contraceptive concerns about this research. Thank you.
Yeah, you're welcome. Thank you so much.